Hi guys, welcome to Pathopulse_Radhika. I know with postponement of exams and raising COVID cases, everyone will be facing a difficult situation. So slowly, I think you should all try to gain momentum and learn at least a few things, and slowly we can build up your speed of your revision. Okay, so it's difficult to start again, but still try to read little by little, and daily you can improve upon yourself. Okay. So today's topic is going to be on mastocytosis. So what is mastocytosis? So mast means mast cells. Cytosis means increase in cells. So mastocytosis is a condition where you have increased mast cells, and this increased mast cells can be in the skin or it can involve other organs depending upon which we call it as a cutaneous mastocytosis or systemic mastocytosis. So basically mastocytosis is increase in the mast cells which can occur in different parts of your body, either in the skin or in the other organs. So going to the basics. So what will be the clinical manifestation when you have a lot of mast cells? So remember, if you know the physiology well, you can understand pathology well. So what does mast cells contain? So mast cell has got certain granules. So they contain certain mediators. So what are those mediators? So mast cells contain 2H. Remember 2H. So they contain histamine and heparin. So when you have increased histamine and increased heparin, what will happen? So that will be the clinical manifestation of mastocytosis. So histamine, you would have read in inflammation. It can cause a lot of reaction. Heparin is an anticoagulant, right? So basically, your mastocytosis is increase in mast cells, and the clinical features will depend upon the release of histamine and heparin from the mast cells. So what is this? So this particular thing is an important thing in dermatology. So what do you mean by Urticaria pigmentosa? So what do you mean by Urticaria pigmentosa? So you have a lot of brown colored macules and papules, especially over the trunk, which we call it as a Urticaria pigmentosa. You can have itching also, you can have pruritus, right? So this is one of the manifestation of mastocytosis, especially if you have a cutaneous mastocytosis, right? So cutaneous mastocytosis usually occurs in children and it can present as Urticaria pigmentosa. So this particular term you should remember. So next, what is this? Suppose you're going to write something. So for example, you're just writing like mast with a pencil or a stroke on the skin, okay, with some blunt ended instrument. You're going to write something, you can write anything or you can just draw a line. So these patients will develop hives, or you're able to see after some time they will develop this hives. So what is this called? This is one feature of mastocytosis. Not only mastocytosis, you can see in other conditions, but it can be seen in mastocytosis. What is this? This is called dermatographism. Okay, so dermatographism. So if you stroke something, they'll develop hives. So this is another important sign in dermatology, which is called Darier's sign. So what do you mean by Darier's sign? So when you're going to rub the lesion, what will happen? There will be edema and erythema surrounding the lesion. So this is because of release of histamine. So remember 2Ds, you can see dermatographism and Darier's sign in case of mastocytosis. So I was telling about the clinical features. So what will be the clinical features? So when you have a lot of histamine, you can have a lot of itching, you can have pruritus, you can have flushing, or you can have urticaria pigmentosa. Those will be the usual clinical presentation, especially your urticaria pigmentosa. Then heparin is an anticoagulant, so rarely the patient can present with bleeding manifestation, either nasal bleeding or GI bleeding. Okay. So now you're going to take a biopsy from the skin, so you see a lot of mast cells. So it's very difficult to identify mast cells by H&E stain alone. So you need certain special stains, certain serological investigations, and certain IHC markers. So this mast cells can have an enzyme called tryptase. So you can estimate your serum levels of tryptase. So if it's increased, it provides a clue that it's a mastocytosis. And the same thing, you can go for an immunohistochemistry. Like for malignancy, epithelial tumor, carcinoma, we use cytokeratin. Likewise, the immunohistochemistry for mast cell, you can go for a mast cell tryptase IHC or CD117. This CD117 you have learnt in so many places. So just post in the comments where else you can have CD117 positive cells. You can get it in other tumors, in hematological malignancies, in certain testicular tumors. You can post in the comment. Okay, so two IHCs is tryptase and CD117, and you have two more, CD25 and CD2. These can also highlight your mast cells. This is all IHC. Coming to the special stain. So what is the special stain which can highlight the mast cells? So you have two special stains. One is called Giemsa and other one is called Toledan blue. So Giemsa and Toledan blue. Why? Because your mast cell will have a lot of heparin and histamine. Those will take up this Giemsa and Toledan blue. So this is about your mastocytosis. Okay. So let me summarize about mastocytosis. Mastocytosis is basically increase in mast cells which can occur in your skin or in the other parts of your body. So because the mast cell contains heparin and histamine, all your clinical manifestations depends on that. So clinically you can have a lot of brown pigmented macules and papules in the skin, especially in the trunk, which we call it as Atricaria pigmentosa. And you have two features which is called Darier's sign and dermatographism, in which if you stroke the skin you can have hives. Here in Darier's you have edema and erythema when you rub the lesion. Okay, so the patient can have pruritus, flushing, or sometimes nasal bleeding and GI bleeding. Your serum tryptase can be elevated. So when you're going to take a biopsy, you can see mast cells. Sometimes they can appear like a spindle cell also. So they will have some granules. That's how you identify a mast cell. So whenever you have a suspicion, you can confirm it by special stain or IHC. Special stain is Giemsa and Toledan blue. IHC is tryptase, CD117, CD25 and CD2. So the CD117 is an important immunohistochemistry marker which is also called c-KIT. So because of this, even mastocytosis people will respond to tyrosine kinase inhibitors. So post in the comments where else you can have CD117 or c-KIT mutations or c-KIT positive tumor cells. So this is about your mastocytosis. It's important from dermatology point of view. All these 3 points: Atricaria pigmentosa, Darier's sign, and dermatographs. So this is in short about mastocytosis. Thank you.